Hello, everyone. This is Dr. Ruchi Shirudkar. I'm a founder and director of an organization called as Pediatric Children at their Fittest. I have been working since last 20 years, and I have been working specially in cases of children, right? So I mostly have a pediatric practice, and I am practicing in Pune, that is a city in India. Uh, we'll be conducting a session online. I've been invited by Austrian Association of Classical Homeopaths, and the topic would be important rubrics of pediatric practice. Right. So I'm going to share. Just give me a second. I'm going to share my screen. Yeah. So the idea behind the period treat was that parents used to come with such bulky files that it used to really pain me seeing children being overdrugged today. So the idea behind was to create a world of happy, healthy children where kids are not popping a pill or drinking syrups for simple ailments like cold, cough, fever. They are just plenty of antibiotics that we are giving to the children these days. I have conducted various seminars and webinars in these last 20 years. I have been invited as a speaker in various colleges and cities in India. And I had presented a paper in Liga, that is Spain, last year, where the topic was multiple facets of ambrogracia. So I had presented, say, 4 cases of ambrogracia in different stages of life. So I firmly believe that me as a physician cannot decide an approach in a case. The approach in a case depends upon the case. So you have, as a student or as a homeopathic doctor, we are introduced to various approach, for example, Kent method or a Boning Hussain method or a Boger approach or various ways. There's a classical homeopath or a homeopath working according to the mind method. And we as doctors feel confused that what to follow. So I strongly believe that it is my duty as a physician that I should be well versed with all the approaches that masters have given, right? It can be a Kentian approach or a Boning Hussain approach. So it all depends upon the case. So how do you take a case when a child walks into your clinic? What is important? Is it a well taken case, or you just observe by some gestures and you prescribe? So there are various cases where we can prescribe from simple gestures, but there will be a case where we take the complete totality and understand the case, or the third where we are just giving importance to the pregnancy history, the past history, the birth history, especially in cases of autism, right? So each case is different. So in my pediatric practice, I give a lot of importance to gestures and history, and everything, right? As I said that, each case is different and the approach also will be dependent on the case. I'll be showing you a case of menstrual irregularity. There's a girl that walked inside the clinic with her mother. ऐसी आवाज बोलो क्या है? So this is a girl who's in 6th standard. She walked inside the clinic with her mother. I asked her what is her name, and she very consciously told her name. And then when I asked her what is the problem, she kept looking at the mother. Actually, bolo, bolo. She was just not answering and kept looking at the mother, and she was very conscious at that time. So I gave her that confidence. I said, okay, you can tell me what's the problem, it's bothering you. क्यों मामा? मैं बताती हूँ। कौन सी क्लास में? 6। बड़ी क्लास में ना? The case is in Hindi, but I will translate it for you. That I asked her which standard you are in. She said sixth. And then I said, okay, you are a big girl. You can answer.
क्या बोलते चेपू बोलो को है ना तेलुगु बताओ क्या
उसको एक्चुअली नहीं पता मैं डिस्कस करके लेके नहीं आई थी
अच्छा गुड
So the mother finally said a good 1-2 minutes she was not able to answer, and then the mother intervened and said she actually doesn't know. She is not aware that why are we here. I have not told her that why are we going to the doctor. And then she told that she has a complaint of irregular menses since the time it has started, and uh, initially for 2 months they were regular, but after that they were coming after every fortnight, and that is why they thought of consulting. So that was the case. And during the case I realized that the child, first is the child is not very confident. Second is, any guesses for the remedy? You can put it, Second is, for a sixth standard girl, she is not even aware that why she's going to the doctor. Is it not very characteristic? Did she never ask her mother that why are we going to the doctor, and why she kept looking at the mother? Because she was not even aware, and she did not know when I asked, why are you here? What is bothering you? Right? So that, that situation itself signifies a remedy, itself talks about a remedy. So the rubric considered in this case was answering aversion to, knows does not what to answer, right? So if you see the rubric, see, it's not that we prescribe from a singular rubric. It is only done when it defines the whole case. For a sixth standard old, for a girl who's in sixth standard, it is obvious that that presence of mind she must have, that why are we going to the doctor, or where are we? But she was just absolutely unaware. So there is written in Baraita Kab that they are inattentive. Basic attention, that where are you going? Basic sense was not there. Paralytic state of mind and body. She's not able to think that, I have come to the doctor, why I have come to the doctor. And she was not able to answer. So when considered this, we gave her Baraita Carb 30 few doses, and she responded very well. So this was first example. Second example, I'm going to show you a small clip of a child. The case is a little longer. We took it in detail, but I'm just going to show you a small clip. She's a small girl. So what happened here was she was playing around comfortably, and parents were telling that, she has a complaint of recurrent cold and cough. She falls sick very often, and she's been diagnosed with a complaint of asthma, right? So when I was taking the detail that how it starts and everything, she wanted to go out of the cabin. And then I said, no, you cannot go. And she looked at the parents, and the parents also refused. I asked them that, please don't allow, so I can see what is her reaction. And that is what she did. She kept shouting louder and louder. You can just hear. Just by a simple contradiction that you cannot open the door and walk out, just be here. That aggravated her so much that she was shouting at the top of her voice. This situation also talks about a child. What kind of children would do this? What kind of remedies would come if we... So the rubric here is shrieking obstinate, weeping obstinate. Because of obstinacy, she's shouting, and she's shouting all the more louder each time, right? There were other various things, but the point here is that as a physician, I should be able to understand these small observations and then incorporate in my totality of the case. Are you understanding? So what the child behaves when the case taking is going on, is he clinging towards the mother, is he playing around, is he touching various things? All that is very, very important. And in these last 20 years I have developed a little acumen to understand these children. How do they behave? It is called as a behavioral materia medica. The moment the child walks in, how he behaves. Of course we'll take physicals and sleep and dream and all the modalities, but these gestures also talks a lot about the child. So we are conducting a session on important rubrics of pediatric practice in association with, actually they are conducting, I've been invited as a speaker, an Austrian Association of Classical Homeopaths. The session would be on 27th of June. Those who want to register for the session, there'll be a link below. So looking forward to conduct a session and have a great, great learning experience. I'll be taking a lot of rubrics that we take in pediatric practice. I'll be showing various cases solved by different approaches. So there can be a case which is solved by a Kentian method, or there'll be a case of pediatrics which is solved by Boger method, or just by observation. So how each case is different and how approaches in different case would be different, right? So it will be all about pediatrics, the important remedies, the important rubrics, and I think it would be a great learning experience for those who want to treat these little toddlers, right? So see you all on 27th of June, and please register on the given link. Thank you.